And we're live. Excellent, excellent. Ziv, I don't think I have to introduce you because you are one of the most prolific, certainly prolific people on social media. You've mastered YouTube and the ability to create a university on YouTube, the Surgical Master University. So we were just briefly talking about your journey and the journey that you undertook. And it starts in Germany. You're born in Germany, and then you go to Israel, and you live a very large part of your life in Israel. So you were just 28-ish, right? And basically, you graduated from Tel Aviv University as a dentist. You come to Toronto, and you graduate from Toronto Imperial, and then that's it. Suddenly, we move to Beverly Hills. And suddenly you're with the stars, right? You know, you're walking down Wilshire Boulevard, all that kind of stuff. And so you connected with Dr. Rosenblatt, who's your partner. And so you followed a course, you know, Perio in Toronto, practice in Beverly Hills, and all of a sudden, surgical master. Okay, where does this concept for surgical master begin? Like, why this passion and this drive to create an educational colossus, as you would?
Thank you. First of all, Ken, thank you for having me.
Sure.
It's wonderful to talk to you again, and we've known each other for many years. So thank you for having me on the show.
Pleasure.
And thanks for the kind introduction. Well, it's actually much simpler than what it is. The surgical master thing was not an overnight thing. I was always into education since I was a kid. A teenager in my 20s, I was always into teaching and educating, even if I didn't know it back then. So I was always instructing and helping. I just had an affinity to it. So when I moved to the United States, I joined USC and I taught at the AEGD, and I was teaching at the continuing education for many, many years before surgical master. But the transition to online teaching is actually really interesting. As I was getting married and getting more and more kids, the life of a conventional speaker, living on a plane and in hotel rooms and being jet lagged and having the so-called glory of a speaker was not practical for me as a practice owner and as a family man. So the logical step was, let's take the live teaching and the travel and let's switch it to online. So that's really where it came from. Mm-hmm. Plus, I met now my partner and my friend, Dr. Rashad Ryman. We had lunch. He's a dentist in Beverly Hills. We hit it off as colleagues and doctors working with one another. And we thought to ourselves, what if we do something online? This was about 9 years ago.
Right.
And then the idea came about. It started with one video, how to deal with the missing buccal plate. I'm sure you've seen it. It had a lot of views. And then I decided to shoot a video every week, every Tuesday. And I had about 2 people on my list. And what I did, every time I gave a lecture or I spoke to somebody, I asked them to check out the video. And I also asked them to join surgicalmaster.com. Mm-hmm. So all of a sudden I had 10 people on my list, and then I would keep shooting those videos out of my office, out of my laptop. In the meanwhile, I upgraded a little bit. And then all of a sudden we had 500 and 1,000 and 10,000 and 20,000, and my emails go viral in the dental world. And then it turned into a business. So mm-hmm. it was pure love for teaching and sharing. And the practicality was, let's go online because I can't travel anymore. I can't leave my practice for a week and come back jet lagged, and then my kids and my wife are upset at me. So it's much easier than what people may think, because a lot of stories we hear are what we call the overnight success. And I don't consider myself successful yet. I'm still in the process of gaining success. But it's not an overnight thing. It was very, very gradual. And it was very organic, and it was a lot of fun, because every week I would just record a 5 to 10 minute video about something. And they were kind of primitive at the time, but I think that's what people liked. They liked the authenticity.
So it's interesting, the context. You're talking now, let's say less than a decade, but certainly 9 years. That's a long push. Um, COVID arrived, suddenly the word webinar is on everybody's lips. Zoom is suddenly like saying Google and that kind of thing. And but you started doing something that at that time is kind of off. It's you straight outside your lane because people weren't doing webinars online. I just spoke to Drew Shaw, for example, who's dental tubules, and he ran into the same thing. He started 2008, 2009, and he started doing webinars. Everybody thought he was crazy. And even as he's saying right now, engagement is essential. I think in your case, because of the sheer numbers on tubules, that they know you already, right? They know what to expect. They know your cadences when you talk, when you present. There's a rhythm to what you present. And so that's what they've come to expect. So in a sense, even though they're not talking to you directly, there's an engagement, a personality that's coming across. Similarly, you started doing things that I thought were really impressive. You started doing graphical presentations. They had a certain artistic presentation style. We're going to talk tomorrow to Dr. Mariano Azar and Ion Zavaglu from Periopixels, who understand that you educate by doing animation without blood, in the case beside it with blood. So in the context of Surgical Master, which essentially became a way of staying home, you have 4 kids, right? I think there are 4 children. Yeah.
4.
And so you're staying home, but it's not everybody. It's like, yeah, I'm going to do videos from the office. Not that simple. It's not quite that easy. Okay, because you can put up, you can put up videos that people look at, or you can put up videos. They have to have a quality standard. So how did you evolve into videographer, cinematographer, producer, script writer, set design, da, 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 da. How did that happen?
Okay, so that's a wonderful question. So on 2 levels. First of all, I love marketing. I'm in love with the topic of marketing. It's actually the oldest profession in the world. It's not what you think the oldest profession, because in order to consume the old profession in the world, that person needed to market him or herself. So marketing is the oldest profession in the world. And I'm just in love with this topic. I think it's just so fascinating and interesting.
Be my guest.
Always. Number 2, it was actually the other way around. My goal was not to impress with fancy graphics or with sophisticated teaching or even with very complex concepts that only a couple people can understand. Actually, I wanted to dumb it down, make it very intuitive and simple, and also communicate in a way that I communicate with people on a daily basis, like we are communicating right now. I hope that I sound clear. I hope I sound concise, and that everybody can hear me through the accent, through the certain things that I like to say. But that's how I communicate in the videos. The other principle that guided me is stay away from perfection. So put the thing out there before it's perfect. You're almost semi-embarrassed, because perfectionism is a disease that all dentists have. And I had it myself. I'm a recovered perfectionist. Perfectionism is one of the worst forms of self-abuse. And I have some definitions for that if you want to get into that.
Absolutely.
But the idea is to put your stuff out there before it's perfect, because if not, you're limited by your own fears. And guess what? Your stuff is better than what you think. And this is advice to everybody listening here, whether it's a speech, a lecture, a conversation you'll have with your staff, your family, put it out there. Just put yourself out there. If you are a genuine person and you're honest and you speak slowly and concisely, I don't like the fluff. I don't like the fat, not the physical fat, that too. But you want to get the fat off, you want to get the meat out there, and then you can't fail, because people see the authenticity, and the transparency is also very important. So I stay away from the graphics. You said my lectures, you said something about artistic and
even when you presented, for example, the static guides, it's certainly, I mean, the Surgical Master introduction is great. I love, just from a
I didn't make it. That's a graphic. That's a professional who did that.
Understood, but it's still part of how you reach people. I think there's a certain level of engagement that if you begin, people need to be drawn into it. So that's an interesting introduction. When I was talking about artistry, it was more you began to show static guides long before, at least from my perspective, I could be wrong, but you started showing static guides, and that's a very compelling looking image. But you started showing static guides, for example, long before on a basic basis that everybody could look at. I'm not talking about these alien, all on whatever reconstruction screw in the side. You know, it's like you look at, whoa, right? You were being very pragmatic. You were very easy to approach. There was a certain allure because of the colors and you know, STL files, whatever. And that's what I was talking about. It's compelling because you're seeing something digital, and digital has color, it has unique textures, and you started to do that early on. So I do want to talk about that, but what you just went through was interesting. I cannot think of anybody that I've spoken to in the last whatever it is who didn't say they would rather address their failures first in order to evolve and to grow. So your point was about, you know, being a perfectionist, a sort of like a lapsed perfectionist or whatever. I think all dentists should belong to Perfectionist Anonymous. They would probably be a lot happier as clinicians and would enjoy things. So could we address that? I mean, could you talk about that? Because obviously it's a very big part of what you do.
Absolutely. By the way, endodontists are the worst perfectionists.
Yep, absolutely.
And they're wonderful at what they do. And dentists are wonderful at what they do. And I strive to do the best. The problem is when you veer towards perfectionism, which is beyond what is required, it's actually not for anybody else, it's just for you. That becomes a problem. And I called it self-abuse before. Actually, somebody, I forgot who, gave it an amazing definition.
Self-abuse.
So the definition of perfectionism is trying to convince the world that you are something that you don't even believe about yourself.
Right.
Think about it for a second, you know, maybe replay it later. Trying to convince the world that you are something that you don't even believe about yourself. So it's a crazy thing. You got to recover from it because it's holding you back. It's affecting your mindset. It's affecting your growth and the pace of you growing. And it's something that should be taken very seriously. And besides, it wastes a lot of time. So right. Stay away from it. Put the stuff out there in any capacity. And I try to do it myself. As you know, addicts can go back to their old habits. So yeah. Sometimes I catch myself and I think, oh, this is perfectionism. Move on. Doesn't mean I don't want my stuff to be great.
Well, so did you, like, obviously it had to be a perfectionist first in order to realize that you were, totally. And then you had to stop. So totally. What was the epiphany? Was it your children, relationship? I mean, I mean relationship with your wife, but the structure sure. of your home life, was that beginning to suffer?
It transcends to all parts of life. And at some point you realize, and maybe it comes with maturity, maybe when you hit your 40s, it says, you know what, I'm good enough. I'm good enough. I'm a good enough clinician. I'm a good enough dad. I'm a good enough spouse. I'm good enough. And it doesn't mean that I don't like to be all that and I want to achieve more than what I have achieved. But it's really being kind to yourself and congratulating yourself for your achievement and not beating yourself up.
Right.
And right. I recovered from that. I feel really good about myself. And here's the testament. And maybe the doctors and people, because this is not just for dentists, this is for people. Mm-hmm. You can relate to that. If you can go to bed at night and sleep really well, knowing you gave it your all today and you didn't screw anybody over, you didn't renege on what you promised, and you really put an effort into every aspect of your life. And I'm not saying that I always do that. You will sleep well at night. So it's the sleep at well night test. And it probably comes with maturity. It comes with time. And the same thing goes in teaching as well. Right. I was very well prepared to our interview, but it was not in a sense, I got to study and think what to do. I was just thinking about the interview, thinking about you. I was getting into a focused mind, into a calm mind. I did my exercise today, so I did my due diligence. That's why I was a little bit late to get started. I I ate my breakfast. I did what I needed to do to be prepared now for this interview. Am I going to ace it? It's not about that. It's about having a great conversation. So
Exactly.
we already won.
So you could have basically just said, okay, I'm tired. I've done it. I've played the game. I'm good at what I do, have my family, but somehow the surgical master became, well, as you said, it grew and grew and grew, but it still had to have a seminal period. So yes, it was getting off planes. Yes, it was having time with the family, but regardless, even if it was very tiny at the beginning, that's still putting yourself out, because you're saying, okay, here's my work, and this is what I do. And that's not something everybody can do, especially if they're a perfectionist at the time. You're not prepared to take pushback. You don't want to have people say, yeah, it's not so good, could have done better. You have to be prepared. Like you say, you have to be kind to yourself and say, look, I have something I want to share. I want to teach. I want people to learn, and this is what I'm going to do. So as it evolved and the time commitment became greater and greater, what was going through your head? Like, it's kind of, you let the tiger go. It was like, you just said, okay, you had it on a leash, and suddenly, okay, you're gone. So what happens at the beginning to get this thing gestating?
There was a whole switch in mindset and a whole switch in philosophy. So if the conventional teaching is meant to disseminate information and knowledge, a teacher teaches, an educator educates, a doctor means teacher. We are basically, by definition, educators, all of us.
Right.
So the concept changed. So we are not giving out information only. We are not just teaching or giving out the knowledge. By the way, 90% of our teachings in our company is free.
Mm-hmm.
The 10%, these are our paid courses. Mm-hmm. So somebody anywhere in the world who doesn't have the funds or the luxuries of the first world countries can tune into Surgical Master through the different capabilities like webinars, like online courses, YouTube, social media, and learn about 90% of the stuff.
Right.
The 10% is, and that's pretty substantial as well as a company, is paid courses and online education, live courses, mentorship, books, audio programs. We have a lot of that stuff as well. Mm-hmm. So there was a very significant switch in the mindset of an educator that I think you will not see in dentistry. Doesn't mean that I'm that unique or our company is that unique, but you won't see it. Our focus, besides information, is the transformation. Okay. We want the dentist not just to take the knowledge, keep it here, maybe apply it, but we want them to be a different person, a better person that has success habits, that has a mindset of a successful person, that feels good about him or herself, and that didn't lose the vision, the greater vision for, again, himself or herself, and not be depressed. Like a lot of dentists are depressed, even with the situation right now. It's a very difficult situation, but you can see the flip side. There are some people that are smiling, that are doing well, and we're all in the same pot. We're all suffering, let's call it financially, but that's not going to last forever. No. So the switch between information and transformation was critical. And I believe personally, it has to do with the success of our company and also the connection with the community. I know we have a 30,000 dentist community.
Oh, really? Wow.
Yeah, we're pretty big now, but we have great connection. Both Rashad and myself, Rashad is my partner. We both oversee the customer support. I mean, we actually go in there and we look at the questions and we look at the problems people are having, whether it's technical or some basic issues people are not getting. We're doing the mentoring ourselves. We now mentor, thousands of people in different programs. So we are hands-on. Is it sustainable for decades? We don't know, because we are now, getting a little bit short on time. But we really put our heart into that. And I'm also addicted to adrenaline. That's another addiction. I love the adrenaline. I love the rush of being busy and doing things, that are greater than life. Mm-hmm. And that helps. That gives you the energy as well.
So I have a question for you. You just brought up something that is obviously the thrust of this entire situation. Like basically this came about because The reason for interviewing rather than doing webinars was you have this amazing group of people who truly understand what passing the baton means and understand what mentorship means. So you just said something that's intriguing, because endodontics, in theory, given the fact that a lot of people coming out of COVID will have let things stay quiet. You know, tooth was sensitive, filling broke, whatever, endodontic problem. There's going to be a rush to deal with not acute pain, but chronic pain problems. So endodontist is going to be forced to sort of wake up to that and adjust to that. But when you say you mentor, is that kind of like a 1-800-perio kind of thing? They contact you and, you know, they ask you, I got a problem, help me diagnose this case. What do I do to treatment plan?
Yeah, that's a great question. It started like that for sure. It started like that when we were much smaller, where the mentee actually had my cell phone number and my email, and they would just text me or call me or email me. That type of mentorship is not sustainable, and it can lead to the mentor being a little bit overwhelmed and maybe not doing their job. So we created the mentorship in a more structured form. So depending on the topic, whether it's implant or soft tissue grafting or anything, complications, suturing, the mentorship is done within a particular group that has its own rules. It's like a mini universe. So there is a time and a place to present your case and get my feedback. It's not just in the middle of the night, Ziv, what's going on? What should I do here?
Yeah,
There's a certain structure that we're trying to improve over time. And the other thing is, everybody has realistic expectations. It's not realistic that 1 or 2 people would mentor 20, 30,000 people. It's just not, come on, it's not possible. So we have to decide on certain realistic rules and realistic way to mentor. And we have different tiers. So we have the lowest tier where you can get like a group mentorship. Then there's smaller groups, and eventually we'll get to the one-on-one. My goal is impact in life, by the way, not just the financial aspect of it. It's the impact to help as many dentists. Our goal is to help 100,000 dentists excel in surgery and reach a certain quality of practice in surgery and in dentistry that will give them not just more income, but will give them fulfillment. This is the transformation I was talking about.
Right.
And that's what people gravitate to.
That's interesting. So
that's what I gravitate to. So it's basically catered to me.
It's the ethos of Ziv. So question, will Zoom make a difference in that? Because you can have webinar rooms and you can expand your groups accordingly?
Sure. We've been using Zoom for many years.
Oh, really? Hello.
Yeah, we've been on Zoom for many years from the moment the company started. We went through all the main webinar systems out there. No need to mention names because it's an evolution. The technology has changed, and once Zoom came into play, became the #1 player. I think about 5-6 years ago, we were on it already.
Really?
Not that we're geniuses. It was just we were in it already. We were running webinars 7-8 years ago with at the time 200-300 people attending, 400 people attending. So for us to have nowadays our webinars attract between in attendance. Registration is much greater. Registration is about 1,500 to 2,000, but actual attendance 600 to 700 people in every webinar is very normal. That's kind of the norm, and we don't really care. I mean, the quality is actually what matters.
Right.
But the technology has evolved, and actually, what we will be looking at is virtual reality as well.
Yes. Okay.
So that's the next level for us, and we're working on that because if you and I can meet in the VR world,
right,
and we can educate and we can do things there, then we're already much closer as a community.
I think that's brilliant. I think, quite honestly, I spoke to Paul Tipton the other day, and that's exactly where he's going. You can't sustain organizations that have bricks and mortar, salaries and this kind of thing. I mean, everybody has to have a salary if the company grows, but to sustain bricks and mortar today, given what's going on, I don't think so. So virtual reality will definitely be the way to go. But you were saying, like, it's interesting. What has come out of this right now is everybody's getting webinar rooms and whatever. how do you justify 1,500, like 2,000 people? They're saying I have 45,000 people. Those metrics are crazy. They don't reflect on the impact of the webinar. Did everybody learn? Or that's supposedly registered, because they're not part of an entity, which is what Surgical Master is. You're a structure, right? You're not just popping stuff out there and seeing where it falls. So when you do this, I know you have 10,000 people. I understand that. So you can project out, but when you do a Zoom room for these people, like get a Zoom webinar going on, how many people are you comfortable with, where you figure that the impact is being made across the board to the greatest number of people who are viewing? Like, do you have a sense of is there a layer at which point you figure you're losing the crowd or things are getting out of control?
Excellent. So that's a very important point that people don't really understand, in my opinion. I don't mean to judge here. A conventional speaker that now transitions, and that's maybe advice, if I may, advice to all the speakers listening to this, or educators. Mm-hmm. When you transition from conventional teaching, let's call it the classroom, the physical classroom, or the lecture hall,
right,
to a Zoom, let's call it a platform, or a webinar platform. What most educators do, they take their same material, put it in the Zoom, and give the same material in the same manner.
Right.
That is a recipe for failure, because you're not sitting in front of the participant or the attendee. Mm-hmm. Even if they're in front of you, a lot of people fall asleep in front of your eyes. Okay. So think about it, Ken. You have people looking now at the webinar, like people are watching us right now. They can do whatever they want. They can browse and check their email. They're not on camera, they're muted. They can go do something else, go to the restroom, come back. You as a speaker on Zoom, you got to get them so engaged that they will not go to the restroom and they have to go. They can't leave, and they must listen to you. Now, here's another beautiful thing. As a speaker, when you use Zoom, and you're seeing it right now, you see how many people are tuning in.
Right.
So what happens, you get the immediate metrics of how you're performing. So if you see the numbers going down, kick it up a notch.
Right.
You see that all of a sudden you're dropping like 10 people every second, that means you're boring. You're not engaging. You're not on point. So actually what I recommend is, yes, you have the knowledge as a speaker, you have the knowledge and you can teach, and you're a wonderful teacher, and God bless you, because this is such, we call it a mitzvah. It's such a great thing that you do for other people. Yeah. But you got to change, you got to adapt to the new world. Don't focus on the perfect slides and the fonts and the site. It doesn't matter. Mm-hmm. Focus on messaging, focus on engagement, focus on connection, tell personal stories. It's like a TED Talk. You got to nail it. Otherwise, the attention span is only 3 seconds.
Right.
Less than a goldfish has. We know that now. So you got to engage them. And by the way, I'm not always successful with it, but I have in mind when I go online, I got to engage them. And I can give you just one tip. The first thing that you need to do when you start a video, if you can, do what we call a pattern interrupt. Because when people go and watch a YouTube video or a Zoom call or whatever it may be, any platform, in their mind, before they even click the button to watch the post or the video, they have already a preconceived notion of what they're going to see. They have an expectation.
Right.
You got to change that completely. And I'm not saying take your shirt off, but say something controversial. Show a controversial picture. Start from an angle nobody even expected it. That's called a pattern interrupt. Sometimes in our videos, you'll see something maybe unrelated that starts the video. You'll see a cup of coffee. You'll see me putting on a mask all of a sudden, walking into a room. It has nothing to do with the message. It's a pattern interrupt. It's a principle in marketing.
Clever. That's clever.
Wake people up. Maybe this person has something to help. And if you're not performing, which happens, then they'll sign off and you try better the next time.
Yeah, no, that's interesting because so far, you know, like what I see, because obviously I'm spending time on it, you'll see, well, we had 500 people. Okay, great. But it's like, you know, anybody who's actually done like ViewMedi or whatever, you know, you'll get, I don't know, you'll get 150 registrants and 60 show up, right? It's not,
And that's good. The show up
yeah,
rate is 25%. You got to know the metrics. It's 25% show up. That's normal.
that's
So if you
normal.
can get to 50% show up, that means that your offer or your offering is lucrative.
Right.
Like your interview series. I've been watching it since you started it.
Thank
I'm
you.
like, bam, you got this guy and this gal and this Ashwini and this, Gluckman. Cool. And it's coming all the time. All of a sudden, Serota is live. Boom, let me check in. There must be somebody there. So that's testament to you. You're doing this. You put the background. I'm giving you some analysis of what you're doing. You put the background, not to kiss my butt. That's not the
No,
idea.
no.
Because you put something in the back there that is kind of stands there. You put, for Ziv Mazor, you put, I think, a pita with falafel.
Yeah.
Okay. That draws the eye. If I were you, I would change it up a little bit also, just things that are, the beach. So I think if you are a speaker, don't, how do you say, don't kind of stay on your laurels, you're a speaker and all that. No, you have to really evolve with it. Even if you've been doing this for 30 years, this is a different medium. People don't have to listen to you anymore. They're not in a room. They're online. They can check out, even if they paid for it, they can check out anytime.
And they can walk away. As I was saying to Drew, I think the fun part of this, or why it's been so enthralling for me, is I've seen Ziv lecture. I love him. I eat him up. I love that dry Israeli sense of humor. It's just kind of laid back, and suddenly it's like a wave. It kind of hits you. You realize how funny he really is. Never, no ego, no outsized ego. He's into what he's doing. Travels forever. But I actually never knew him at the level we did. I mean, it was just very interesting to find out who he was. Roberto Rossi, Ashwini, Raquel. I mean, it's a cavalcade of stars and whatnot. And it's like pretty humbling that they're going to come on and do this. But the point of it is, anybody who watches it now know who they are. They know what their passions are. They know what their interests are, what their background, where this. Personally, I think it makes a huge difference the next time they go see them educate, because the barrier, the wall that always exists, no matter what, it's not there anymore. Like you've seen them, it's like without their clothes off. It's like they're open. They've just opened up to it. And personally, for me, it's a ton of fun. I love it. But it's I hope if there's anything that comes out of this, is that people who go to see people who've taught go, wow, I really know that guy. Can't wait to meet them. I mean, same as you, for example. I remember when you started out, Surgical Master went very strong on YouTube, but it graduated. You went to the Surgical Master Handbook. Didn't you come up, isn't that your own design for the suturing? Didn't you manufacture that? You had that suturing thing set up?
Yeah.
So you started off with the suturing. Then you moved into crown lengthening, which, given that it's an aesthetic world, makes a lot of sense, right? That became very relevant and very important. And you started to do the hands. You were what's the name of the school? It's at Ostro School of Dentistry. Isn't that where you did a lot of your stuff? So you started out, you go into Ostro, you're doing these courses. You started bringing people in, like Delia Tuttle started coming in with you, I think. But again, they were not programs like, I wanted you, like you walk out and you go, oh my God, I can't do that. But they were fundamentals. And that's the point I was trying to make. You dealt with fundamentals. Everything was a build. So can you talk about that? Like, how did you, instead of overwhelming them and trying to say, well, you can do this, you can become jack of all trades, master of none. But you took a very different approach. You said, okay, day one, it's not even beginner, intermediate, and advanced. It's suturing, okay? Integral part of all success. Let's teach you how to do that. Maybe it makes something else easy. Can you talk to that, Ziv, please?
Absolutely. So the idea behind teaching is giving.
Mm-hmm.
Is giving. And what you want to give is something that the other person can consume. So you will never give a baby pistachios.
Mm-hmm.
They have nothing. They don't even have teeth. They can't even chew it. They can't even open it. They'll probably choke.
All right.
What a lot of doctors are doing, a lot of educators are doing, is giving pistachios to babies. You're teaching them to run before they can even crawl. They got to crawl. They got to go on their knees. They got to fall a couple of times. They got to get some confidence before they start running. So that's the same concept in my teaching. And by the way, I always been like that. I always wanted to, let's go to basics. Even if you're a hotshot surgeon, let's go to basics. Let's see, what are your knowledge gaps? What are your blind spots? We all have them. You have them. I have them. And we just don't know them. We're blind to them. That's one of the main issues. And it so happens, if you go to basics, you can always gain, you can always strengthen, and you can always benefit. And it always feels good, even if you know it. Even if you already know it, you get a reassurance, I have a good base. So my concept in my teaching was, and this is, by the way, the reality, most doctors have those knowledge gaps. They do fancy surgeries, all on 4, all on 5, but their suturing sucks.
Yeah.
Or their soft tissue management is less than ideal. Let's go back to basics. So I started a lot of fundamentals. For example, I wrote an ebook that was downloaded about 20,000 times.
Really?
It's called How to Extract the Money Tooth.
Right, right. How to extract the money tooth. Right,
the money tooth, which is a low molar. I gave the protocol of what I do. That was a hit right away. Why? Not because it was that brilliant. It was actually very primitive, and I designed it all myself. But I gave it out for free because people, for the first time, had a recipe of how to extract the lower molars. A lower molar. What are the steps? What instruments to use? You know, how much time you spend on each instrument, and the whole shebang. The whole thing is like 20 pages. And I started doing things like that. And you said people ate it up. People ate it up because it's basics. We want to know that. And the same concept was in suturing. So it's not a big philosophy behind it. It's just give them what they can consume.
Right.
And so happens. Now, if I'm going to now be mentoring Howie Gluckman, I got nothing to give him. I can maybe give him some marketing advice. You know, I can give him some advice about, you know, how to approach in teaching in the new world. And I think the world of him. So, but I'm not going to I have nothing to teach him surgically. He can teach me. So, but as an educator, give them what they can do. Number one, so give them knowledge that is pertinent. Number two, encourage them. Give them support. Don't judge them. Don't belittle them. Give them a pat on the back, mentor them, give them honest feedback and criticism, and empower them to do great things. And that's my philosophy. And I really love it. It's so satisfying to see other doctors that come out of our programs saying, I did that. Mm-hmm. Yes, they talk about, you know, we made all this money in this production. I don't care about that. Mm-hmm. And they don't care about that either. I mean, it does help their families and does help them, you know, be more financially sound. But the fulfillment and the satisfaction, you can't put a price tag on that. That they did a great surgery, and the patients were thankful and appreciative and referred the rest of the family. There's one of the human needs. You know, the need to contribution is a very strong human need. And if you satisfy that, then you're unstoppable.
Sorry to interrupt you. You're doing something. I mean, I really thought of it this way. If you go to a lecture and you see like these monster cases, but you're nowhere near that in your practice, like forget it. You know, geez, like really, bone blocks and massive grafts and epithelial grafting, and you know, sinus lifts and all that kind of stuff. If you're just starting out, you know, if you really, if it's fine to aspire to that, But don't take a course and suddenly decide you can do it, right? You know, you've got a 3mm crest of bone. Oh, no problem. Densiver, goodbye. No. It's like everything else. There's learning curves. There's experience. There's the understanding that if you fail, that's okay. That's fine. Everybody fails. So the take I have on what you're doing is you're saying, whoa, whoa, you want to run? Great. But you better learn how to crawl, or you better learn how to walk after you're crawling, because you want to go run, you're going to fall on your face. So it's interesting because you're obviously going through a lot of builds right now. You introduce suturing, you introduce crown lengthening, which is, as we said, you want to do aesthetic dentistry, you bloody well better know how to make sure the scalloping is even. You know, laterals are down, cuspids are like, I mean, you don't just slap veneers on. But by the same token, then you move it into static guides. And I looked at it at the beginning and static. And suddenly it dawned on me that you were saying, look, I know you can place it freehand, but why don't you raise your bar? You know, it's not expensive. You have to integrate scanners and CBCT. But you know what? You want to get better? Go that extra step. So was this like, is this how you conceived of this? Or did this just happen? Or was this a progressive evolution in your mind? What was going on?
You know, that's how I am. I don't want to overanalyze it and think there was something, some type of sophisticated idea. It was very organic. It was seeing what the market needs. We do a lot of surveys. We do a lot of social interaction or online social interaction with you know, dentists in the community. And I know this is what is needed. So okay. I'm not going to spend 6 months creating a course, a fancy course, full production, tons of, you know, expenses about something that I have a passion about. I'm going to find out what the doctor needs. I'm going to create a tiny little training. I'll see how that goes. I'll deliver it to the world. If it does great, I know I'm on the right track.
Right.
If it flops, I'm not on the right track. So I'll do something else.
Right.
So, but it so happens that the basic things you can never lose, because you know, the foundation, the people at the, not at the bottom, not the totem pole, you know, we're all equals, but the people just at the beginning of their road, their learning curve, there are always more. Think about it, there's always more graduates than people retiring.
Yeah,
there's always more new people coming into the market,
right,
which is how it is,
right.
like kids, you know, there's always a wider base there. Right. Guess what they need? They need foundation.
So can I pick your brains about marketing for a second?
Sure, absolutely, okay. I'm yours.
So you got a new graduate, just out of school, got a fairly dense marketplace. He's competing against a lot of people. In some cases, it's completely oversaturated. Patient base is not dwindling, but you know, things are changing. People don't have insurance benefits. They're on contract work, this sort of thing. So, I mean, social media is what it is. So we've got people marketing on Instagram. They go on LinkedIn to see if they can grab the executive people in the area. Twitter. The only thing that dentists aren't doing yet is TikTok, but I'm sure TikTok is going to come very shortly. You know, add a little humor. What's that?
Dentists are doing TikTok.
Dentists are doing
TikTok. Is huge in dentistry. If you want to get a good following, by patients, you should go on TikTok.
Okay, go on TikTok.
Go on TikTok now. I'm not on TikTok. My goal in marketing is not for patients. My patients are referred by dentists, so I market to the dentists that I work with in different venues. But go on TikTok. Wow. TikTok is huge.
I watch my kids do it, my grandchildren do it, and I'm going, oh my God.
I got a couple of TikTok videos. You should check it out with my daughter. But it's not, it's just for fun. That was not it's not for marketing. But you should go on TikTok because your patients are on TikTok. You got to go where your patients are.
Outrageous. Who would have thought?
Nobody.
So, but you're running it now. You've got a school of the airwaves kind of thing, or at least of the digital wires. So somebody starting out, they want to get involved in social media, whether they want to use it as a teaching platform or not, it doesn't matter. I mean, you're teaching patients, you're teaching dentists. There's a commonality. So you start out on social media. Now you were saying before, is even with these interviews, I put them up on my news feed. I started a YouTube thing, very easy, called Passing the Baton, and when I'll put it up. So what else do you think matters in terms of that? Like, you obviously data mine. You have to, because you're trying to sift through you can't look at the metrics because all you're looking at is the top, it's like looking at the gross without taking away the expenses, right?
Mhm.
So you obviously are doing some pretty sophisticated analysis of the people that are part of your cohort of viewers, subscribers, people who take your courses. So how is that done? I mean, do you have a method of how you do the analysis?
Okay, so that was a
I'm
long
asking you to give it away.
Like, I don't know where to start. Would you just sharpen the question? How do we market?
Well, yeah. Well, you have to, in order to market, you have to know who your market is.
Exactly.
Not only do you have to know who your market is, but like all of these analytics on Facebook and whatnot, you need to find out, when do they open the email? Do they open the email?
Sure.
Did it take a day? Did it take a week? What time of the day did they do it? So you're out on YouTube, right? You're putting your stuff on YouTube. Do you, and obviously if somebody wants to do it, they're going to market their practice. I mean, ideally the dentists are using Instagram. So the question becomes, if they really want to do it sophisticated, they have to get a business platform. They have to be on, do it from a business standpoint, or whether it's that way or not. But I want to know if it's working. How do I know if my social media marketing is working? Or am I just wasting my time, throwing money, good money after bad?
Okay, it's all about KPI, key performance indicators.
Okay.
Okay, that's all it is. So you can, again, we're talking now generally speaking, not about myself or new grad. It's just generally speaking, anything that you want to achieve in life, you need to have some metrics. You want to have more money or make more money, then it's usually not the opposite. Usually it's more. If that's your goal, then the best KPI is what? Is your bank account. You just log in and you see how this thing is moving up and down. You see it immediately. Sometimes it's a happy moment, sometimes it's a painful moment. So basically, you got to have your KPIs. Don't just do stuff just for somebody told you to do it. Have a certain goal. If your goal is to market to patients, you don't have to reinvent the wheel. The wheel was already invented. People are doing it. Learn the best practices. I personally don't do it. I don't market to my patients. I'm marketing to my patients other ways. I'm doing it through engagement. But if you want to use the social media, there are tons of gurus, real gurus, that teach how to do it. There's some fake prophets as well that teach you all sorts of stuff and just take your money. So learn it from somebody who's been there, done that. Then this person will teach you, these are the important metrics. For example, the metrics for a webinar are not so relevant, or the metrics for registrations are not relevant. It's the metrics of showing up. By the way, go to Zoom and you can print a beautiful report and see who attended, for how long, when they signed off. Very important, but tons of information. What do you do with this information? So if you have a certain key performance indicator, for example, for people scheduling a consultation with you, then you have to have a certain technological ability to tie your marketing effort with the consults in your office. And then from those consults, how much was actually produced. If you're missing this part of the equation, then the whole thing is useless. Mm-hmm. Because maybe you got all these patients in because the corona ended and it's nothing to do with your marketing. You want to make sure that it's connected to know if you need to invest in it more. When it comes to myself, when it comes to my own marketing to dentists, through the educational program, we're doing a lot of surveys. We're putting a lot of content out there. We see how it gravitates, but it's all about segmentation. We want to segment our marketing. For example, Facebook knows how to do it very well. They'll show you ads that are relevant to you. Right. Unless your wife was checking your Facebook and all of a sudden you'll see things that have to do that nothing to do with you. Right. It's like seeing an ad on television what does that have to do with me? I'm not even, it doesn't pertain to me. You can now tailor your your marketing to a certain population. So segmenting this population, whether it's endodontist, general dentist interested in surgery, general dentist interested in surgery between the ages of 30 and 50. And in order to do the segmentation, I'm taking you a layer deeper into segmentation, is you got to find your ideal avatar. An avatar could be a patient, it can be a customer. So I went through this exercise many times over the past years. I was thinking, who is my perfect mentee? Who is the person that I would love to mentor and teach? And I literally wrote a 10-page document where I described this person. We called him Bob. Who is Bob? We described who he is, what he looks like, how many kids he's got, where does he live, what does he feel, how much does he make, what is he scared of. I really got into this avatar of Bob in my own company. And then my marketing and my material was geared towards Bob, because in my mind, this is my ideal customer. Guess what? When we gave our live course, do you know how many Bobs showed up? Tons. The Bobs showed up and they looked like we described them.
Really?
There was some ladies too. So KPI is the key. What do you want to achieve, and find the metrics to match that? I know it sounds huge, and a lot of people watching this, I don't even know if I can even do that. I'm just trying to get my first video online. So do that. Do that. Sometimes you just have to go for it, and there's really no downside.
So how did you get that? How did you get the analytics for the data? How did you start to sift everything down to that?
The analytics is very simple, because anytime you put content out there that requires people to log in to see the content, you can obviously capture their email, and you can tag, and I can tag Ken as being interested in guided surgery. Cool. Right. So you know what? I'm going to send you things about guided surgery. Why would I send you things about pedo? You're not interested in that. That's the key in marketing right now: personalization, customization, and segmentation, to make sure that the content that you're getting is pertinent and relevant. So, and that obviously, first of all, you're doing a great thing. I'm not bothering you with stuff that doesn't interest you, doesn't pertain to you, and it's almost like I already know you. And it's not ninja stuff. It's not some stuff that is either illegal, or it's customized marketing.
So if I'm a dentist out in practice and I want to get engaged in social media, so if I'm understanding what you're saying, so my software should allow me, you can ask for you can ask people to like you on Facebook, like you on Instagram, it's on your front desk. That's all very cool. And you can show the number of people who offered it to you. But the flip side of all that is to do an analysis of the database of your patients, like how many children, their birthdays, their hobbies, where do they work? I mean, you can have them fill everything out and figure it all out, right? So the clever move would then be to segregate the population of your patients, then segregate them male, female, whatever number of children, all your string variables can be laid out. And so what you're saying is, if you want to get your practice to grow, you go after these individual segments, these individual variables, and approach them in that context. Is that the take-home message?
Well, the question is why. If you're looking at your existing patient pool, you already got them in your practice.
Right.
And probably they gravitated towards you for a reason. I'm talking more about getting new patients into your practice. Right. So for example, if I had to market to patients, I would put a lot of information out there that would help patients for free.
Right.
As they obtain this information, Facebook has something called a pixel. You can pixel those pages, and you can then go back to those people that visited you and tell them, hey, I got some more stuff for you. So there are a lot of ways to do it. My advice is, don't learn it from me. Learn it from people that teach those best practices in regards to online marketing. But you need to be the content creator.
Content creator, right?
Yeah, you got to create your own content, and it doesn't have to be have to be very sophisticated, or you don't have to be a speaker or a university professor. Just share some advice with people that you care about, and show that you genuinely care, and just make it short and concise, and offer the advice, and give them the opportunity to contact you later.
I didn't mean to interrupt. I was just thinking about something. The reason I was asking about doing with the existing database is that when I was in practice, I got to the point where I don't refer me, the referrals. I mean, obviously I have to make a living, but the referrals were such that it was, do I buy them a Christmas present? Do I do this? Do I take them for dinner? The best part of the practice over time was we started internally marketing aggressively. And when I left practice, 25% of my referrals came from patients, right? So it wasn't, I went, you go outside, you lecture, you do this, you do that, you do whatever. But, the culture that you create internally, if you use social media to these people, like you said, what do you do when you're pregnant and dental care? What do you do with your 2-year-old? What do you do with this? So it's like two vectors intersecting. You go into your practice, do the data analysis, you data mine, and you say, well, okay, I'm not going to talk to you about dentistry, or this is Susie's birthday coming up. I'm going to provide the information, the peripheral information about dentistry internally and then externally. The only reason I bring it up is I think a lot of dentists feel that to commit the resources and the time and the content creation to go outside their practices, you literally have to almost dedicate a person in your practice full time to do it, if you really want to do it effectively. The flip side is to use like a Dentrix or whatever software you have and try and mine it internally and then figure out your program. So it's inordinately complicated, but as you've just described, you have a passion for it and you've done remarkably well with it. And congratulations. It's extraordinary what you've achieved in a short period of time. I mean, I don't know how people measure, milestones, but you've done it, my friend. It's really impressive. You went at it fundamentally, but by the same token, the marketing and engaging people was done very sophisticated. It exceeded what the average person does. You weren't just slopping stuff on Instagram or whatever. It was very determined and very focused. And that's amazing in and of itself. That's incredible that you did that. It's distinctive. It wasn't sort of, okay, let me put it this way. I'm trying to sort of how to articulate. You didn't use the shotgun approach to marketing, right? You used the sniper's approach to marketing. And
I like snipers more. Sometimes you need a shotgun, by the way.
Okay, right.
But yeah, I like the sniper mentality, not in the context of war. I'm all against killing people in war, but the sniper mentality is extremely important in anything that you do. You make your decisions after thinking things through. You stay very calm. You look at the target. You pick your target, and I really connect with it again in the positive sense. So yeah, I agree. And by the way, thank you for all the the compliments. I don't see it this way. I feel I have a lot of room to grow and do a lot of greater things. And I feel it's all a work in progress. So if you're watching this, don't feel hard on yourself because you haven't done 20 videos and they reach, a million views. Don't feel hard, start with one. I'm sure you have something to say, something to contribute. The patients in your practice are the low hanging fruit, so to speak. You reach out to them, show them that you're a genuine, real person that cares. If you're an educator, don't live in your ivory tower.
Mm-hmm.
Things have changed.
Yeah.
Knowledge is readily available and a lot of it is free. Concept has changed. The media has changed. Now we see it more than ever, and it's here to stay. So adapt to it.
And they will. Thank you for this, because I mean, what we just talked about, you can be the most skilled clinician in the world. If you can't convey to people what those skills are and why it's to their advantage to have them performed on them. You just, it's like driving, you got a Ferrari, but you have no gas. You know, it makes no sense. So listen, I really appreciate this. I'm glad the opportunity finally arose to sit down and chat with you. I love Surgical Master. That's so cool. Surgical Master. Thank you, Ziv. I appreciate it. Go back and play with your children, because you're going to have more time to play with them now than you ever will for a very long time. Okay? This is a good time to be with your family. I appreciate this very much. Thank you for being on. I think it's great. It was wonderful to talk to you. Have a good day. Okay, be well. Talk to you soon. Okay, bye-bye. Thanks.
Bye.
Okay.